Hello everyone, I have a question for you. Does metformin cause hypoglycemia? You are in a fit state. So, glucose levels in your body increases. Simultaneously, there is secretion of insulin. So what happens? Your body glucose level reaches to normal range. In diabetic people, there is insulin resistance. So, the glucose level still remains high. So, when they are given metformin, see, only metformin is given, monotherapy, no other drug is added. And in them, there is normal secretion of insulin. Suppose there are 4 molecules of insulin. Metformin, it makes these 4 molecules of insulin more potent. It doesn't increase secretion of insulin. Whatever insulin molecules which are existing previously, those insulin molecules become more potent with metformin. As it is not increasing the secretion of insulin, so there is no hyperglycemia. Hypoglycemia. Those drugs which increases the insulin secretion, they cause hypoglycemia. So the answer is no, or very rare.